Hi folks, this is Hariom for CBNR. Today we are going to see a sort of a random topic rather than a specific topic. Today I thought we will talk about something which we all proclaim, that is, we treat the pathology or the underlying cause rather than the symptom. So I just want to sort of give us some ideas surrounding this particular notion. The first thing I would suggest is there are sometimes we know the etiology very clearly, right? There are certain instances where the etiology is very clear so that we can treat the etiology. Say, for example, we know that why you get a malaria, right? We know the vector, we know the causating bacteria and things like that, so that you can have a treatment which kills those things, right? Sometimes we don't know the etiology very well, but we know the pathology fairly better, right? Say, for example, Bell's palsy, right? We are completely unaware or sort of clueless about the etiology accurately, right? We have some idea, I suppose, but we have a fairly good idea about what is the pathology. That is, there is a swelling of the nerve. In most cases, probably sometimes you also have a retroviral infection. So you have a fairly good treatment which sort of targets these two things, that is your inflammation and bacteria, right? In a lot of conditions, we may have a good idea about the pathology, but we don't have a great about the etiology. Even if we know the pathology very well, we may not have a good treatment for the pathology, right? Say, for example, diabetes, right? We know that there is, we don't know the etiology naturally, probably some genetics, probably some other reasons also. We have a good idea about what's the pathology. There is some problem in your pancreas, but we don't treat the pathology because we have limited knowledge in how to treat the changes happening in your pancreas, right? But we know how to manage your symptoms very well. Likewise, so there are a lot of conditions, but we will not go into all these things. So it doesn't matter. What matters is, do we have a good management for our patients, for them to live relatively healthy or with a good quality of life, right? Now you may ask me, so what's the point of all these things? Now we will have the same examples in orthopedics. This is where it all gets slightly, or that's the point I want to make. Say, for example, if you have a fracture, right? The etiology doesn't matter because you have fallen or broken your bone. Now we know the pathogenesis, we know the what happens after the fracture and things like that. But what we are actually doing, in a sense, is we are not healing or changing the pathology in any way, right? The pathogenesis or the healing and things like that. What we are doing is we are giving a good environment for the fracture to heal, right? We keep the bone in the right alignment as far as possible, stop the infection from happening. For that, you do a good dressing. If it is an open wound, probably a prophylactic antibiotic and things like that. And then you just wait for anywhere from 6 weeks to 12 weeks, depending upon the type of fracture. The healing happens by itself, right? Here, this is where I want to make the point. The healing happens in a particular timeline. You are not doing anything, in a sense, what we are doing is we have made the environment properly for the healing to happen, and just wait. Now, if you take the same thing for your back pain, right? If you assume that the back pain, we don't know the etiology, again, we don't know the etiology properly, and we are not very sure also about the pathology. We have some ideas, right? Probably sprain and strains might be the commonest reasons for back pain, but we are not sure. What we are not sure is what sprain or strain of what tissue we can't find out. That is the issue, right? Or whether the tissue which is injured is actually producing the pain. Say for example, you can have a lot of changes in your MRI, but we don't know whether that is causing your pain, right? Now, whenever I see a lot of people saying that I will cure it in 1 day, 2 days, the first place, the cure itself is a nonsensical word, as you may all know, right? Now, I want you to ask this question, right? If it is a sprain or a strain, what are we treating? Are we treating the sprain or strain, or the strain or sprain is healing by itself? If it is healing by itself, then what are we doing, right? Whether it is a NSAID or whether it is a physiotherapy, then what are we doing? Without asking this question, we are all arguing about things which I don't know what is what, and we keep on saying that I'm curing it in 2 days. If you come to me, I will get your back in the spick and span in another 5 days or something like that. How are we saying all these things if we assume that the problem is strain, right? Or any tissue damage, right? Any tissue damage. Remember, in the last 50 years or something like that, 50,000 years if you will, we have not changed the time of healing, right? The time of healing is the same, whether it was in the Keeley time or today, right? Healing time has not changed. So what are we changing? What are we managing, right? So that is the question for today. It is not a video about what the answer video or something like that. This is a question video. So hit me with your answers or whatever comes to your mind. Thank you.